In this video, we're going to be discussing a complication of diabetes which causes damage to the area at the back of the eye, which is the retina. This is called diabetic retinopathy. We're going to be covering what diabetic retinopathy is, risk factors, symptoms, screening, stages of diabetic retinopathy including real-life clinical photos, treatment, and finally top tips for prevention. So let's start off by exploring what diabetic retinopathy is. Well, it's a complication of diabetes caused by high blood sugar levels damaging the back of the eye, which is called the retina. The retina is the light-sensitive layer of cells at the back of the eye that converts light into electrical signals. The signals are sent to the brain, and the brain turns them into the images that we can see. The retina needs a constant supply of blood, and it gets this through a network of tiny blood vessels. Over time, persistently high blood sugar levels can damage these blood vessels, and it can cause blindness if it's left undiagnosed and untreated. However, it usually takes several years for diabetic retinopathy to reach a stage where it could threaten your sight. The good news is that you can minimise the risk of this happening by keeping your blood sugar, your blood pressure and your cholesterol levels under control, as well as attending your annual diabetic eye screening appointments, which will help you ensure that any problems you have are picked up at an early stage. So now we know what diabetic retinopathy is, you might be wondering, am I at risk of getting it? Well, anyone with type 1 diabetes or type 2 diabetes is potentially at risk of developing diabetic retinopathy, and you are more at risk if you've had diabetes for a long time, you've got persistently high blood sugar levels, high blood pressure or high cholesterol, if you're pregnant, or if you're of Asian or Afro-Caribbean background. So now we know a little bit more about what diabetic retinopathy is and who might be affected by it. Well, let's take a look at the symptoms. Well, in the early stages, you won't usually notice diabetic retinopathy, as it doesn't tend to have any obvious symptoms until it's more advanced. However, early signs of the condition can be picked up by taking photographs of the back of the eyes, and this is usually done during diabetic eye screening. The symptoms to look out for and contact your optician immediately if you're experiencing them are gradually worsening vision, sudden vision loss, shapes floating in your field of vision, these are known as floaters, blurred or patchy vision, as well as eye pain or redness. Now, these symptoms don't necessarily mean you have diabetic retinopathy, but it's important that you get them checked out, and you shouldn't wait until your next screening appointment to do so. Now, here in the UK, everyone who's 12 years old or older will get invited once a year to annual diabetic eye screening. And the aim of this is to pick up a condition early. And this is important because diabetic retinopathy doesn't tend to cause any symptoms in the early stages. We also do screening because the condition can cause permanent blindness if it's not diagnosed and treated promptly. And importantly, screening can detect problems in the eyes before they start to affect the vision. The screening test usually involves examining the back of the eyes and taking photographs. Depending on the result, you may be advised to return for another appointment a year later, attend more regular appointments, or discuss treatment options with a specialist. So now let's discuss the stages of diabetic retinopathy. And it's important to do this because diabetic retinopathy develops in stages over time. Stage 1 is something known as background retinopathy. This means that tiny bulges, known as microaneurysms, have appeared in the blood vessels in the back of your eyes. This may leak small amounts of blood. This is very common with people with diabetes. At this stage, your sight isn't usually affected, although you're at higher risk of developing vision problems in the future. You don't usually need treatment, but you'll need to take care to prevent the problem from getting worse. And the chances of it progressing to the stages such as stage 2 and stage 3 within 3 years is around 25% if both of your eyes are affected. Now, stage 2 is something called Preproliferative retinopathy. This means that more severe and widespread changes are seen in the retina, including bleeding into the retina. At this stage, there's a high risk that your vision could eventually be affected. You'll usually be advised to have more frequent screening appointments every 3 or 6 months to monitor your eyes. Now, moving on to the more advanced stage, stage 3, this is known as proliferative retinopathy, and this means that new blood vessels and scar tissue have formed on the retina, and this can cause significant bleeding and lead to retinal detachment. This is where the retina pulls away from the back of the eye. At this stage, there's a very high risk that you could lose your vision. Treatment will be offered to stabilise your vision as much as possible, although unfortunately it's usually not possible to restore any vision that has been lost. There's also something called diabetic maculopathy. In some cases, the blood vessels in the part of the eye known as the macula, which is the central area of the retina, can become leaky or blocked. If this is detected, there's a high risk that your vision could eventually be affected. You may be advised to have more frequent specialised testing to monitor the eyes, and you may be referred to a hospital specialist known as ophthalmologist to discuss treatments that can help stop the problem from getting worse. So now let's have a very brief discussion about something that is very important, and that's how to reduce your risk of diabetic retinopathy. There are lots of ways to do this, but I'm just going to give you 5 key things that you should try to do, which we'll briefly discuss here. So firstly, try to control your blood sugar, blood pressure and cholesterol levels. Try to take your diabetes medicine as prescribed. Thirdly, try to attend all of your screening appointments. This is so if you do have a problem, it can be picked up and detected early. Fourthly, get medical advice quickly if you notice any changes to your vision. And finally, maintain a healthy weight, eating a healthy, balanced diet, exercising regularly, and if you smoke, please try to stop. So by this, I mean eating a healthy, balanced diet. In particular, this is important to cut down on salt, fat, and sugar. In terms of losing weight, well, if you're overweight, you should try to aim for a body mass index or BMI of between 18.5 and 24.9. This will usually mean exercising regularly, and you should aim to do at least 150 minutes of moderate intensity activity, such as walking, cycling, or doing 10,000 steps a day. That can be a really good way to try and reach this target. Finally, I'm going to briefly discuss with you treatment options. So diabetic retinopathy usually only requires specific treatment when it reaches an advanced stage and there's a risk to the vision. It's typically offered if the screening detects stage 3, which is known as the proliferative retinopathy, or if you've got symptoms caused by diabetic maculopathy. At all stages, managing your diabetes is crucial, so getting your blood sugar under control is really important, and in fact, that's the most important part of treatment. Treatments for advanced diabetic retinopathy are mainly 3 things, and we'll discuss them very briefly here. So firstly, laser treatment. Laser treatment is used to treat new blood vessels at the back of the eye in the advanced stages. And this is done because the new blood vessels tend to be very weak and they often cause bleeding into the eye. Treatment can help stabilise the changes in your eyes caused by the diabetes and stop the vision from getting any worse. But remember, it won't usually improve your sight. The second option for treatment are eye injections. In some cases of diabetic maculopathy, injections of a medicine called anti-VEGF may be given directly into the eyes to prevent new blood vessels from forming at the back of the eye. And finally, eye surgery. Surgery may be carried out to remove some of the vitreous humour from the eye. Vitreous humour is the transparent jelly-like substance that fills the space behind the lens of the eye. I'll go into more detail about each of these treatment options in a separate video, including how each one works, possible side effects and complications. So please make sure you subscribe to the channel for this if this is going to be of interest to you. Finally, remember to contact your optician immediately if you develop any problems with your eyes or vision, such as gradually worsening vision, sudden vision loss, shapes floating in your field of vision, known as floaters, blurred vision, or eye pain or redness. Just go get seen as soon as possible. These symptoms don't necessarily mean you have diabetic retinopathy, but it's important to get them checked out straight away. I do hope you enjoyed the video and you learned something new. And if you did, please remember to consider liking it, leaving me a comment if you've got any other thoughts or you'd like to share your experiences, and please consider subscribing to the channel for weekly medical education videos if you've not done so already. Please also check out the references and resources that I used to make this video. These can be found in the description box. There's lots more useful information that's contained within these links. And finally, for medico-legal reasons, I do have to stress that this has been designed as an educational video, not a clinical advice video. And for legal reasons, please do read the disclaimer in the description box of the video. If you've got any concerns, please go see your doctor. And as ever, thank you for watching, and until next time, bye.